Could that persistent backache or weight loss be more than just getting older? Many dismiss subtle discomforts, but what if your body is quietly signaling a serious health threat like pancreatic cancer? Experts stress that recognizing early, often overlooked, signs is critical. We'll reveal 7 crucial indicators, backed by health professionals, that need your immediate attention. Don't let a silent threat grow unnoticed. If you care about your health after 60, this is a video you'll want to watch till the end. For those of us enjoying our golden years, maintaining our health and independence is paramount. That's why understanding subtle signs our bodies might give us, especially for conditions that can be tricky to detect, becomes incredibly important. Pancreatic cancer, unfortunately, is one such condition. It's often called a silent disease because its early symptoms can be vague or easily mistaken for less serious age-related issues like indigestion or general fatigue. As we age, our risk for many cancers, including pancreatic, naturally increases. For seniors, recognizing these 7 signs early isn't about causing alarm, it's about empowerment. It opens the door for earlier diagnosis and, crucially, more effective treatment options that might not be available if the cancer is advanced. Think about what matters most: spending time with loved ones, enjoying hobbies, maintaining your energy and independence. An undiagnosed or advanced pancreatic cancer can severely impact all of these, leading to pain, fatigue, significant weight loss, and a diminished ability to live life to the fullest. Conversely, catching it early means a better chance of preserving your quality of life, allowing you to continue enjoying your retirement years with vitality and comfort. Alright, let's dive into our first crucial point: the appearance of jaundice, often referred to as penyakit kuning in Indonesian. This is a telltale sign that frequently manifests when pancreatic cancer, particularly tumors located in the head of the pancreas, begins to grow and exert pressure on surrounding structures. So, what exactly is jaundice? It's a medical condition characterized by a yellowish discoloration of the skin, mucous membranes, and most noticeably, the whites of the eyes, sclera. This yellow hue is caused by an excess of bilirubin in the blood. Bilirubin is a yellowish pigment that is a natural waste product from the normal breakdown of old red blood cells. Normally, the liver processes this bilirubin, making it water-soluble, and then excretes it from the body as part of bile. Bile, a vital digestive fluid, travels from the liver and gallbladder through a network of ducts, eventually reaching the common bile duct, which empties into the small intestine. Now, here's where pancreatic cancer comes into play. The head of the pancreas is anatomically nestled very close to the common bile duct, the main pathway through which bile flows from the liver and gallbladder to the small intestine. If a tumor develops in this part of the pancreas, even when it's still relatively small, it can compress or obstruct this vital bile duct. When the bile duct is blocked, bile cannot flow freely into the intestine as it should. Consequently, bilirubin backs up into the liver and then spills into the bloodstream, leading to the visible yellowing of the skin and eyes that defines jaundice. Beyond the noticeable yellowing, this obstruction can lead to several other uncomfortable and concerning symptoms. You might notice your urine becoming unusually dark, resembling tea or cola, because the kidneys attempt to excrete the excess bilirubin from the blood. Conversely, your stools may become unusually pale, clay-colored, or even white, due to the lack of bilirubin reaching the intestines, which normally gives stool its characteristic brownish color. Another common and often distressing symptom accompanying jaundice is generalized itching, pruritus. This occurs as bile salts, unable to be properly excreted, accumulate and deposit under the skin, irritating nerve endings. Jaundice, particularly when it appears suddenly and without an obvious benign cause like hepatitis or gallstones, should never be ignored. For pancreatic cancer, it can often be one of the earliest and most visible signs, especially for tumors located in the head of the pancreas, making it a critical red flag that prompts individuals to seek medical attention. While not all jaundice indicates pancreatic cancer, its presence warrants immediate and thorough investigation by a healthcare professional to determine the underlying cause and initiate timely intervention. Have you experienced this? Share in the comments. Next, let's delve into a symptom that often raises a significant red flag for pancreatic cancer: jaundice. Jaundice is a condition characterized by the yellowing of the skin and the whites of the eyes, sclera, and it occurs when there's an excess of bilirubin in the bloodstream. Bilirubin is a yellowish pigment formed when red blood cells break down, and it's typically processed by the liver and excreted from the body as part of bile. In the context of pancreatic cancer, jaundice most commonly arises when a tumor grows in the head of the pancreas. The head of the pancreas is strategically located near the common bile duct, which is a tube that carries bile from the liver and gallbladder to the small intestine to aid in digestion. As a cancerous tumor in this region expands, it can press on, or even directly invade, the common bile duct. This compression or blockage prevents bile from flowing normally into the small intestine. When the bile duct is obstructed, bile, along with its bilirubin content, backs up into the liver. From the liver, this accumulated bilirubin then overflows into the bloodstream, leading to the characteristic yellow discoloration seen in jaundice. It's important to note that this type of jaundice, often referred to as obstructive jaundice, is a direct mechanical consequence of the tumor's presence. Beyond the visible yellowing, this blockage can also manifest in other telltale signs. Because bile cannot reach the intestines to color the stool, bowel movements may become unusually pale, clay-colored, or even white. Conversely, as the body tries to excrete the excess bilirubin through other pathways, urine can become unusually dark, resembling strong tea or cola. Furthermore, the accumulation of bile salts under the skin can lead to intense, persistent itching, which can be quite distressing. What makes jaundice a particularly concerning sign in pancreatic cancer is that it can sometimes be painless. Unlike other conditions that might cause jaundice along with significant pain, a pancreatic tumor might initially cause only the bile duct obstruction without much discomfort in the early stages. This painless presentation means individuals might delay seeking medical attention, mistaking it for a less serious condition. Therefore, any unexplained onset of jaundice, especially when accompanied by pale stools or dark urine, warrants immediate and thorough medical evaluation to rule out serious underlying conditions like pancreatic cancer. It serves as a crucial indicator that something is impeding the body's normal bile flow, and prompt diagnosis can significantly impact treatment outcomes. Have you experienced this? Share in the comments. Moving on to our next critical indicator, let's discuss a less commonly recognized but highly significant sign: changes in your bowel movements. Specifically, we're talking about a condition known as steatorrhea, which manifests as pale, bulky, unusually foul-smelling stools that often appear greasy and may be difficult to flush. This distinctive appearance is due to an excess of undigested fat in the feces. The pancreas plays a vital role in digestion by producing powerful enzymes, including lipase, which is specifically responsible for breaking down dietary fats. When a pancreatic tumor begins to grow, especially if it's located in the head of the pancreas, it can obstruct the pancreatic duct, preventing these essential digestive enzymes from reaching the small intestine. Without sufficient lipase, the fats you consume cannot be properly broken down and absorbed by your body. Instead, they pass through your digestive system largely intact and are excreted in your stool. This malabsorption of fats not only leads to the characteristic appearance of steatorrhea but also has significant implications for your overall health. Over time, this chronic malabsorption can lead to unintentional weight loss, as your body isn't absorbing the calories it needs, despite a normal or even increased food intake. Furthermore, it can result in deficiencies in fat-soluble vitamins A, D, E, and K, which are crucial for various bodily functions, potentially leading to other health issues like bone weakening or vision problems. The insidious nature of pancreatic cancer means its early symptoms are often vague and easily dismissed, making the recognition of such specific changes even more vital. It's important to distinguish this from occasional digestive upset. The steatorrhea associated with pancreatic cancer is typically persistent and progressive, while other conditions such as celiac disease, Crohn's disease, or even certain medications can cause similar stool changes. The new onset of these symptoms in an adult, particularly when combined with other subtle signs like unexplained weight loss or abdominal discomfort, should immediately raise a red flag. These changes are not merely an inconvenience. They are a direct consequence of the pancreas's compromised function and serve as a crucial early warning signal that should prompt immediate medical evaluation. Ignoring such a persistent change in bowel habits could delay a diagnosis that is critical for improving treatment outcomes. Have you experienced this? Share in the comments. Next, let's delve into a less commonly recognized, yet critically important, indicator of potential pancreatic trouble: new-onset diabetes, or the sudden, unexplained worsening of existing diabetes. The pancreas is not only vital for digestion but also plays a crucial role in regulating blood sugar levels by producing insulin. When pancreatic cancer begins to grow, especially in the body or tail of the pancreas, it can directly impair this essential function. The tumor's presence can damage the insulin-producing beta cells within the islets of Langerhans, which are clusters of cells in the pancreas responsible for hormone production. This direct cellular destruction reduces the body's ability to produce sufficient insulin, leading to elevated blood sugar levels. Beyond direct damage, the growing tumor can also cause inflammation and structural changes within the pancreas, indirectly affecting insulin sensitivity throughout the body or interfering with the release of insulin. In some cases, the tumor might even release substances that cause insulin resistance, further complicating blood sugar control. What makes this sign particularly noteworthy is its often subtle presentation. Unlike typical type 2 diabetes, which usually develops gradually over years and is often associated with obesity, a sedentary lifestyle, or a strong family history, pancreatic cancer-related diabetes frequently appears suddenly in individuals who don't fit the usual profile, perhaps older, non-obese individuals with no prior family history of the condition. Furthermore, existing type 2 diabetes that suddenly becomes much harder to manage, requiring significantly higher doses of medication or insulin without any clear dietary or lifestyle changes, should also raise a red flag. It's not merely a coincidence. It can be a direct physiological consequence of the growing tumor disrupting the pancreas's delicate endocrine balance. Therefore, any unexplained and rapid onset of diabetes, or a sudden, dramatic deterioration in existing blood sugar control, warrants thorough investigation beyond standard diabetes management, as it could be an early warning sign of a more serious underlying condition. Have you experienced this? Share in the comments. Moving on to our next point, a less obvious yet highly significant sign that pancreatic cancer might be growing in your body relates to changes in your blood sugar levels. Specifically, we're talking about the sudden onset of diabetes, or a noticeable and unexplained worsening of pre-existing diabetes. The pancreas is a dual-purpose organ, playing a crucial role not only in digestion but also in regulating blood glucose through the production of hormones like insulin and glucagon. Insulin, produced by specialized cells called beta cells within the pancreas, is essential for allowing glucose to enter cells for energy. When a tumor begins to grow in the pancreas, it can directly or indirectly interfere with this vital function. A cancerous growth can physically destroy the insulin-producing beta cells, leading to a deficiency in insulin. Furthermore, the tumor can induce inflammation or release substances that make the body's cells more resistant to insulin resistance, mimicking the mechanisms of type 2 diabetes. In some cases, the tumor might obstruct the pancreatic ducts, leading to chronic pancreatitis, which in turn can damage the insulin-producing cells. What makes this symptom particularly insidious is that new-onset diabetes, especially in individuals who do not fit the typical profile for type 2 diabetes, e.g., older age, normal weight, no family history, can be one of the earliest indicators of pancreatic cancer. If you suddenly develop diabetes without the usual risk factors like obesity, physical inactivity, or a strong family history, it warrants a closer look. Similarly, if you already have diabetes and find that your blood sugar levels are suddenly much harder to control, requiring significantly increased medication or insulin doses without any clear lifestyle changes to explain it, this should also raise a red flag. It's not just about high blood sugar readings, it's about the unexplained nature of the change. This isn't to say that every new diabetes diagnosis points to cancer, but rather that it's a piece of the puzzle, especially when combined with other nonspecific symptoms such as unexplained weight loss, fatigue, or abdominal discomfort. Recognizing this connection is vital, as early detection of pancreatic cancer significantly improves treatment outcomes. Have you experienced this? Share in the comments. Next, we turn our attention to a critical, yet often subtle, indicator: the development of new-onset diabetes or a sudden, unexplained worsening of existing diabetes. This particular sign is deeply rooted in the pancreas's dual role within the body. Beyond its well-known function in producing digestive enzymes, the pancreas is also an endocrine gland responsible for manufacturing vital hormones, most notably insulin and glucagon, which are essential for regulating blood sugar levels. Insulin, produced by specialized cells called beta cells within the islets of Langerhans, facilitates the uptake of glucose from the bloodstream into the body's cells for energy. When a cancerous tumor begins to grow within the pancreas, it can directly interfere with this delicate hormonal balance in several ways. Firstly, as the tumor expands, it can physically infiltrate and destroy the insulin-producing beta cells. This direct damage reduces the pancreas's capacity to produce sufficient insulin, leading to elevated blood sugar levels, a hallmark of diabetes. Secondly, the presence of a tumor creates a localized inflammatory environment and places significant stress on the entire organ. This chronic inflammation can impair the function of the remaining healthy beta cells, making them less efficient at producing or releasing insulin, even if they haven't been directly destroyed by the tumor. Lastly, emerging research suggests that pancreatic tumors can sometimes release specific substances or cytokines that induce systemic insulin resistance. This means that even if the body is producing some insulin, the cells become less responsive to it, further contributing to high blood sugar. The diabetes associated with pancreatic cancer often presents uniquely. It may develop suddenly in individuals who do not fit the typical profile for type 2 diabetes, for instance, those who are of normal weight, maintain a healthy lifestyle, or have no family history of the condition. Furthermore, existing diabetes might suddenly become much more difficult to control, with blood sugar levels becoming erratically high despite consistent medication and dietary management. For clinicians, new-onset diabetes in an older, non-obese individual or a rapid, unexplained deterioration of long-standing diabetes should raise a significant red flag and prompt further investigation for underlying conditions, including pancreatic cancer. While it can be an early indicator for some, it often becomes noticeable when the tumor has grown enough to significantly disrupt pancreatic function, underscoring the importance of recognizing even subtle shifts in your health. Have you experienced this? Share in the comments. Finally, let's turn our attention to a sign that might seem unrelated at first glance but is critically important: the presence of unexplained blood clots. While blood clots can occur for various reasons, such as prolonged immobility, surgery, or genetic predispositions, their sudden appearance without any clear precipitating factor, especially if they are recurrent or migratory, can be a subtle yet significant indicator of an underlying malignancy, particularly pancreatic cancer. This phenomenon is often referred to as Trousseau's syndrome or migratory thrombophlebitis, and it's a classic paraneoplastic syndrome associated with several cancers, but notably pancreatic adenocarcinoma. Pancreatic cancer cells have a unique ability to release substances directly into the bloodstream that promote blood clotting. These procoagulant factors, such as mucin and tissue factor, activate the body's clotting cascade, leading to a hypercoagulable state. Essentially, the cancer creates an environment where blood is much more likely to clot than it normally would. These clots can manifest in several ways. Most commonly, they appear as deep vein thrombosis, DVT, typically in the legs. Symptoms of DVT include swelling, pain, tenderness, warmth, and redness in the affected limb. It's crucial to note that these clots can be migratory, meaning they might appear in one leg, resolve, and then appear in the other, or even in different parts of the body. More dangerously, a piece of a DVT can break off and travel to the lungs, causing a pulmonary embolism, PE. A PE is a life-threatening condition characterized by sudden shortness of breath, chest pain, rapid heart rate, and dizziness. The significance of unexplained blood clots in the context of pancreatic cancer cannot be overstated. Often, these clots can be one of the first signs that something is wrong, appearing even before more typical symptoms like jaundice, abdominal pain, or significant weight loss become apparent. If you experience a blood clot without a clear cause, especially if you don't have other risk factors, it warrants a thorough medical investigation that includes screening for underlying cancers, with pancreatic cancer being a strong consideration. Recognizing this less obvious symptom can be vital for early detection, which is paramount for improving outcomes in this challenging disease. Have you experienced this? Share in the comments. Here are 7 practical, safe, and moderate health tips to support your overall well-being. 1. Embrace a balanced diet. Focus on incorporating a variety of whole foods, including plenty of fruits, vegetables, and lean proteins, to nourish your body. 2. Engage in regular physical activity. Find enjoyable ways to move your body consistently, as regular activity supports circulation and overall fitness. 3. Maintain a healthy weight. Strive for a weight that feels good for your body, as this can support various bodily systems and energy levels. 4. Be mindful of lifestyle choices. Consider exploring ways to reduce or avoid smoking, and practice moderation with alcohol consumption for long-term health. 5. Prioritize adequate sleep. Aim for consistent, restful sleep each night to allow your body to restore and rejuvenate itself. 6. Practice stress management. Discover healthy techniques that help you cope with daily stressors, as managing stress can positively impact your physical health. 7. Stay hydrated. Drink plenty of water throughout the day to support essential bodily functions and help you feel your best. As we wrap up, thank you from the bottom of our hearts for joining us on this journey. Your presence truly means the world, and if anything we shared today resonated with you, please consider giving us a like to show your support. Every share helps us reach more beautiful souls who might need to hear this message, and hitting that subscribe button means you'll never miss out on our future adventures together. Most importantly, we'd absolutely love to hear your voice and your story. Please take a moment to comment below and share your own experiences. Your wisdom enriches our entire community. And for our cherished senior viewers, please remember that your life's journey, your accumulated wisdom, and your unique perspective are incredibly valuable. It's never too late to embark on new adventures, to share your gifts, or to inspire those around you. Keep shining brightly, keep exploring, and remember, your most vibrant chapters might still be waiting to be written.